Hello everyone, I'm Dr. O, your nursing fairy godmother. I am here to help you to become a better nurse. In this video today, we're going to be talking about become a better nurse tip number 1, which is know your medication. Nurses, we know that one thing that we are always proud of is giving those meds and taking care of those patients who are depending on us. So, in becoming a better nurse, giving med is number 1 tip. Now, we don't just give med. You want to give med that you know what you're giving. It is very, shocking sometimes when you see a nurse passing meds and you ask them, oh, what's that med? And they don't know what they're giving to a patient. And it's embarrassing for a nurse to go to the patients and say, hey, Julie, this is your medication. Julie is, what's this? Are you going to say, I don't know. That is very embarrassing. So it is very critical that nurses know what they're giving and why they're giving it. You also need to know the side effect of those medications that you're giving to the patient in case anything happens. There is a change in your patient's condition. You should be able to know, the side effect of Depicot is drowsiness. Julie is very drowsy today. Let me go and see what the Depicot level is. And that's because you know what Julie is getting and you know the side effect of it. And of course, you know what the med is for. Now, the question most of you are going to ask me is, how do I know all my meds? I give so many meds in a day. In a nursing home, for example, you have one nurse with at least 30 residents during the day shift. How is this nurse expected to know all the medication that they're giving to 30 residents? And studies show that average med per resident in a nursing home is at least 7 pills per 1 person. So that means you may have people who are getting 15 meds, 10 meds. How are you going to know all of them? Let me give you a tip. What I did when I was, a young nurse. I used to know my meds by using a flashcard. I go look up the med in my medication book. Then I write down the side effects of it in a flashcard. Then when I'm home after dinner, I'll be looking at them, I'll be reviewing them to know the side effects. And this is only on the new meds, of course. As nurses, you know a lot of the medications already. So anytime you come across a new medication that you don't know, please, before you give it to anybody, you need to go and look it up and know what is the medication for, the side effects, and even the doses of the medication. So now you guys are lucky you have Google. You can always Google the meds, look it up, write it down. You can use the flashcard, or you can just write them down, and have a picture of it in your phone. But however you do it, it is critical you look it up. You write it down somewhere, because I noticed that when you write something down, it's very easy for you for whatever it is to sink in your brain. Please look up your med, know your meds. That's our tip number 1. Thank you very much for all that you do, and we appreciate it. I will see you next time.